Hello, everybody. Welcome back to the Resilient Aging Unfiltered Podcast. Thank you for joining us. Today, we have a fantastic guest talking about a topic that's important to me. And also, I have a lot to learn about. So I'm so excited to welcome Dr. Yousef Mohammadi to our studio today. Thanks for joining us, Dr. Yousef.
Thanks for having me. Appreciate you, Dani.
Same. So I will give a brief bio about you and then we'll jump in. And I'm going to just call you Dr. Yousef to make it easy on me.
So it's fine.
But I think I heard, do you go by Dr. Mo also?
Yep. Mo, Larry, and
Okay.
Harry. It's easy to remember.
All right, cool. I got options. Excellent. All right. So Dr. Yousef is a board certified family medicine and integrative medicine physician at Lifescape in Scottsdale, Arizona. He's passionate about nutrition and integrative or holistic medicine, an evidence-based practice that respectfully considers the whole person, overall physical, mental, spiritual, and emotional well-being before recommending therapeutic modalities for healing. He has an additional interest in sports medicine and is concussion management certified. He practices full spectrum family medicine with an integrative functional augmentation, and so his desire to address the root cause of health ailments and love for holistic approaches, whether from ancient wisdom or modern advancements in medicine, led him to pursue these 2 fellowships in integrative medicine and functional medicine. Wow, that's a lot. Well, wonderful. Thank you for joining us today. Can you
Thanks for
tell
having
us
us.
how you ended up wanting to bring all these things together?
Sure. I appreciate you taking the time, and thanks. It's an honor, obviously, to connect with you again. You've done quite a lot of training, so I'm impressed by your background and value you offer our patients too. And so for me, I think the journey started really by love for animals. When I was a kid, I loved all sorts of animals, and I thought I was going to be actually a zoologist or marine biologist. Through school, I just really fell in love with the anatomy and just realized that I'm really social. I like to bring people together, that sense of connection with others and seeing them happy really lit me up. And so I realized that, the connection with people and just like love for anatomy and biology just seemed like a natural progression to kind of look into medicine. So I pursued that path and went down that path and really was fascinated by it. But through my medical training, I feel like always there was something missing. And I think it was around my residency first year in family medicine, where I had a gentleman who was assigned to me for his back pain, and he was on controlled pain medicines. He was on muscle relaxers and anti-inflammatories, and I was supposed to manage his care, but then also try to get him off of his medicine or being down as we're trying to keep him safe. And this poor gentleman was coming from a long distance, like an hour away, and just miserable, was not feeling well, wasn't doing well with the protocol. And I just kept asking, what else can we do for him? This can't be everything that, I can offer this gentleman who was large and a lot of back pain due to injuries in the past. And so at the time, we had a medical director of education, and she mentioned to look into Dr. Wild's program in Arizona. And I was like, I had no idea about any of that world. I looked into his work with, natural healing and decided to do an externship out in Tucson at the University of Arizona and got exposed to so many modalities that we ended up trying to utilize for the gentleman that I was taking care of, including acupuncture, and the rest is history. And so I just got exposed to all modalities of ancient wisdom that really can help augment what we learn in Western medicine and our training in med school. And that was my beginning of my journey to kind of be humbled and also continue to learn and stay curious to all the ancient wisdom that we have from our past generations, but also modern technologies that come on that, build research and have additional resources for our patients to heal. So that's kind of where we'll all start.
Great. Thank you for sharing that. Can you help us understand the difference or define integrative medicine and then functional medicine?
Sure, I can give you kind of a different version, I guess. I would say integrative medicines to me seems like a bigger circle where it encompasses kind of all the practices of medicine, whether it's, Ayurveda from Indian medicine, whether it's, traditional Chinese medicine or Native American medicine. That has different layers of evidence that is more specifically focused on addressing ailments through natural therapies herbs and botanicals or other practices. And that functional medicine really goes to the root cause of, the ailment, but more specifically biochemistry focused, more specifically addressing the root cause and not band-aid therapies of treatment only. But I think there's a massive overlap between the two. I would say at least 50% of the things I've learned, there's shared between both practices.
Yeah, for sure. And the way our healthcare system is and where it continues to go, it seems like, and I know for myself, I work with older adults with memory loss and Alzheimer's and their families, and it's tough. Like, how do you fit that all in, and how can people access that, or how our healthcare system is so problem based and reactive?
Yeah, that's a wonderful question. And it's probably why all of us are where we are now.
Yeah.
Just, identifying that as a big, difficult hurdle to provide quality care and to see true results for our individuals we care for. And, that's what we went to medicine, all of us. And so I think it requires time. It requires more time because you can't understand the full story of a patient's care, or where it all happened. And that's why we spend a great deal of time with our patients that come in. So we spend about 2 hours with our new patients, where my old system had 20, 40 minutes at best to spend with them. So I would say one is having more time to spend with our patients. Two is really truly seeing what their goals are. A lot of times when you know someone's goals, if you know about their why, then you can also arm them with effective tools to getting them to their goals. Because I can provide a supplement recommendation or tell them about a new therapy, but if that doesn't really connect the dots between them wanting to, like you've mentioned before, them spending time with their grandchildren or going on a bike ride that they could not do and have been missing it because of their injury, that really lights someone up. That really, gets them excited.
Yeah, that's great. I feel like just asking a patient these days about their specific goals is such a relief for them. It's so rare, and it really shifts the conversation immediately from it being about the physician's goals, and then everything's already predetermined. And it's like, if you're, like our healthcare system, like, you already know like what the end is, and we're just like checking the boxes to get to the end, and takes the person really out of the equation in many ways. So just starting that conversation is so powerful. I'm
We're all
curious.
humans.
Go ahead.
Yep.
Yeah,
I'm
yeah,
sorry. I was going to say we're all
yeah,
humans. So
yeah.
that's the one thing that I think distinguishes us from just, a robot checking a box, right? And it's just that human connection between a practitioner and patient,
Mm,
personal connection.
yeah. So, I love working with older people. It's my passion. And I'm wondering about, with your specific work area in integrative and functional medicine, what are you seeing are the biggest health challenges for older adults these days, especially maybe in the US?
Absolutely. I think the biggest one that has continued to progress is metabolic health. We know our cellular ability to be able to utilize energy and then not overly pack on the pounds, if you will, and become inefficient in using energy and gaining weight. And, that is one has continued to be a challenge for a lot of our patients as certainly we age too. Another one, we would say definitely cardiovascular health. We're learning a lot more about ways to actually prevent one of the biggest, killers in one's health and mortality morbidities. And also mobility and stability. I'm blessed to be able to work with a lot of our patients who are in their 50s, 80s, or 90s. And so, as you as well. And so a lot of times that ability to stay stable when they're moving about, from their muscular and bone health, and then also ability to do certain activities to stay safe and do them, is something that is a challenge. I really look at that as well. So, and I would say another one is brain health, which is your baby, Lissy. And so being, neurocognitively intact, being able to stay sharp, it's something very near dear to me because my father's got dementia. And so the one thing I remember he specifically was, mindful or, concerned about was like, I don't want to lose my mind. I want to make sure that I'm present. And, it's very scary. So I think all of those are pretty foundational subcategories of health that I think we see a great deal of challenge, but also good opportunity for us to tap into and treat it correct so we can have people live long and healthy.
Yeah, great. I love all of those. And they're all interconnected, of course, as you know better than anybody. And I'm wondering about your framework for approaching someone, say you meet someone for the first time and they've been in the traditional healthcare reactive problem-based system. And let's say they have a lot of issues, especially in those areas like metabolic, cardiovascular, they have hypertension, cholesterol, diabetes, whatever, not exercising. I know I think about, well, I'm obviously brain health, brain centric, but I think about approaching it from how do we build the reserve and the resilience? So that's like one of my like underlying ways I structure this and approach this. And I'm wondering how how you think about that in a way that your goal, well, wanting to help them ultimately, like themselves engage in these overall health practices.
Sure. Great question. I would say it all starts with really having a good history and a good understanding of their story, if you will, right? The story that describes them, and that time really helps us have that story and truly get to know someone. But beyond that, I always go back to kind of like the five pillars of health. That really kind of brings the 80% of your success and progress, and the 20% could be all the other things you tap into, all the fancy things you hear about. But like the five are kind of like the sleep, the hydration, nutrition, movement. We would call it exercise. We'll just say movement, and also stress management or practices of that. And I would say if you get those five correct, you're probably 80% there. And the 20% would be your, new modalities, new devices, the red light, the peptide, the hormones, certain medications and certain supplements. And so we don't want to get lost in the weeds. And I feel like those five are so crucial, and so many of us can improve still to kind of optimize our health. But that would be a good place that I usually try to
Mm,
start. But then also look and see, what does their story tell me? Occasionally I'll talk to someone and they seem to have a great deal of gut related issues. So I know that we have to really focus on addressing, getting stool samples and getting a sense of their digestion, absorption, their food intake, and connect them with our amazing functional dietitian who we have at our office. And so sometimes I listen to their story and they sound very allergic. They got atopic dermatitis and they've got certain allergies and food reactions and this autoimmune condition. Okay, so the immune system is an area that we got to really focus and, decode. So it just depends on what system really speaks. And I think, and one thing that really I enjoy about the functional approaches is that you might have someone who has 10, 20, 30 diagnoses,
mm,
but we really can kind of find that one or two diagnoses or the core root cause that kind of feed into all these other conditions. And if you can correct that area or that condition, everything else will,
yeah.
I like be in this, spiral progress improvement. A good example of it would be if someone's got sleep apnea and low testosterone and metabolic health issues and insulin resistance, diabetes and arthritis. Well, if you can correct the metabolic health issues and they start to lose weight, they might now have better testosterone and then more workout and more and feel better. And so, and all that will spiral in, and now they're sleeping better. And now their,
Mm,
position is improved, and it can potentially address multiple conditions instead of just this pill for this ill and, multiple different treatments for different conditions.
great. Can you say those five pillars again?
Sure. So I would say they are sleep, hydration, nutrition, movement, and stress management.
I love that. Those are so we all understand what those are. They're not like high level confusing terms. So that's fantastic. Uh, let's talk about one of your passions. Let's talk about nutrition.
Okay.
So, and specifically for older adults, I get a lot of questions and I try to give personalized responses from my patients and families. I'm not formally trained in nutrition or integrative medicine, but I'm curious if you would say for older adults, besides like the common, I guess, but like the Mediterranean diet is, in the brain health world, like promoted still. But what would you say beyond that is good?
Yeah. I love Michael Pollan's work, that he's had a lot of stuff out and, just kind of talks about eat mostly, vegetables, real food. Not too much, mostly vegetables. And so, I think nutrition is probably one of the most confusing concepts in medicine and as a whole. And there's
Mm,
so many different recommendations out there by different people. And I think we're moving toward a direction of science, specifically looking at genetics and epigenetics that are driving each individual's nutrient choices and nutrition in the coming decade, which is exciting. But as a whole, I would say, there are definitely certain things that can support, our individuals who are trying to stay healthy and have quality life and make sure nutrition is one of those pillars that is addressed, and really focusing on whole foods will be that one item. If you enjoy cooking, it's such a blessing because the art of cooking is exciting. It's fun. You can get involved with your family, your loved one, and you spend quality time with them. And then you know exactly where your ingredients come from. We can talk about shopping local, shopping organic, make sure it's non-GMO, making sure that you stick with, particularly ingredients that are not sprayed with chemicals, and use certain apps like Dirty Dozen and Clean 15, and to make sure that some of your produce are selected from areas that are safe. But, again, not everybody may love that. So if you're going to go delegate that food opportunities to a chef or some restaurant, we may or may not know what they use. Are they using the right ingredients? And so sticking with whole foods is really helpful from a perspective of nutrition density, and also keeping chemicals, pesticides, a lot of other things out of our diet. And that's even really more important because our food is not the same as it was 50, 100 years ago. They've done actually measurements of concentration of food, and they've seen actually a decline in actual quality of food, nutrients in the food actually. But the other component is also, I would say, really just simply spending time like eating not alone. We're human beings and we're social beings. And one of the questions we ask our patients who come in to see us on my intake is, how many meals do you have with other people in one day? And I'm surprised sometimes I hear zero. And some very, very busy, very, successful individuals who are constantly traveling, they get to, not have a meal with another individual, or maybe just one. And so, if we look at blue zones of the world, community sense, and then just slowing things down and eating together, eating mostly plants are a common method that we receive, So granted, there's diets of all sorts for different individuals, and we're seeing, I've had examples of individuals who carnivore diet work well for them. There's someone else who keto works well for them. But
Mm.
as a whole, like you mentioned, common things are common. Most of us probably benefit from something that's anti-inflammatory, has phytochemicals that are reducing inflammation and oxidative damaging radicals, foods that are rich in, seafood, that are small items that are, not at risk for mercury, or turmeric, green tea, pomegranates, cacao, flax, chia, and there, the list goes on. But I would say the main thing would be to, if you enjoy cooking, to tap into that, shop local, shop organic, and then really stick to fewer ingredients. If you're shopping out, they always say shop the premise of the shop, the store, not the middle, because all the processed food with many, many ingredients are usually in the middle in the boxes. I like the concept of getting things that have maybe 5 or less ingredients in them if you're going to go shop and get things, if you're not getting an elemental item for food. I'm not sure if I answered your question, but I kind
Yeah. No,
of,
you did. You answered it like times 100. No, I love all of what you're saying. And I was, especially the part about the social aspect or community. And you just gave me this, help me make this connection, or analogy with that, what we know about the intentionality of exercise or movement. And if you're thinking and aware of like how your movements are positively impacting your body, specifically in certain muscle groups or things like that, like you actually change your body composition quicker than if you're exercising mindlessly. And so similarly, I would imagine when you're more intentionally curating your meals, and that includes in the space and the people in the setting, you'll probably have more positive impacts on your body and your health from doing it that way. And I guess I never like officially made that connection for nutrition. So thank you for that.
appreciate that. Yeah, it definitely helps reduce the cortisol level too, which you
Yeah.
said, you mentioned exercise, which is a fantastic tool, but same with like eating with people you enjoy, being around people you actually genuinely enjoy, helps digestion, and also helps reduce the amount of sympathetics and stressors in our hormone levels, and helps parasympathetics again more. So they've done studies, they've looked at this, and even things like, adequate amount of sleep and the recovery phase, and deep sleep and non-deep deep sleep
Mhm.
If you have adequate amounts, they have less spikes in sugar and glucose levels in the morning and better habits and better composition. And so a lot of this, like you mentioned, are very interconnected.
Yeah. Yeah. Great. Amazing. In terms of what's exciting things are coming out now for older adults in that space, or in the, the fields you're in and technologies and wearables. And I mean, you mentioned some apps, but again, I'm always like focused on if you could frame it from a lens of older adults given and in this country, how they're living. Is there anything that's exciting for you that you could share?
I think I'm following the progress, and I'm always very excited when effective and helpful tools come out. And I certainly agree. I'm wearing a Whoop now, and I know there's a lot of people who love some sort of a wearable that they whether it's an Apple Watch or Oura Ring or Whoop or a CGM continuous glucose monitor, kind of capture some data. And I think we're just past the age of this screenshot of your current basic vitals, even though that, one would say the heart rate, the blood pressure, the respiratory rate, the oxygen level, would be, great to have, and temperature or pain scale. We're beyond that. I think the next 5, 10 years, and there's already many, many companies that are working on collecting multiple different wearables and markers that are measured on different devices, not to overstimulate and stress out individuals, but rather to gather data on one digestible report that can look at weeks to months of this data and then report that to our physicians. So instead of me looking at someone's vitals coming in, I can get that report that looks at past 3 months of their vitals, their heart rate variability, the quality of depth of their sleep, the number of steps they've taken. And so there are companies right now actively working on that. And I think when I think about our elders, fall risk is huge. So, if we can monitor, let's say, a DEXA scan that looks at the bone quality and also muscle composition would be a really good, parameter to consider. But then also if there is a device that's in the works to kind of get a sense of one's balance and stability as they're moving about their day. I mean, these things are probably in the works. So these data points would be really helpful. So if I can reduce someone's fall, which is probably the worst thing that can happen to our elder people, this has the highest mortality and morbidity as we get older, just because of the complexity of recovery, whether it's blood clots, loss of muscle, recovery to physical therapy, and many other things. That's number one thing. So anything that gives us data that can help us keep someone on their feet and
Mm,
safe, maintain their muscle and bone, which are super important organs, would be huge. But then other things would be like balance. So I think parameters that I'd be really excited to receive in the future would be, a nice report that looks at their metabolic health, their, let's say, the sugar levels,
mhm,
the quality of sleep, let's say their, heart rate variability or depth of sleep and recovery, their vitals, blood pressure and heart rate and oxygenation and so forth. I'm sure, looking at like, and things like that as far as rhythms, it can become more mainstream.
mhm,
But things like grip strength, things like there are other, markers that we check
mhm.
throughout the sensor beyond just the sugar would be interesting to have.
Great. I love that. Is there an age range? So, of course, there's a lot of talk about Alzheimer's prevention, and now there's some programs coming out in that space. And I was thinking about there's a lot of, I'd say, midlife people or late or like geriatric millennials who I like that term, who are very gung ho about trying to prevent that because maybe they've seen a family member. And I'm wondering if you could speak to, is there an age window that once you hit that, all that and all of these, training and education and experience you have, like it's time to like change your lifestyle or like really brutally evaluate your health and well-being and make changes if you really are committed to that. Like, I mean, everyone's different, but generally would you say like when you hit 40 or even younger, is that something you can speak to?
Yeah, I mean, I definitely can relate to that given my father's
Yeah.
experience. But I think there's, it's never too early, honestly. I was at a conference recently, or the pediatrician was talking about longevity, or she was like, I know you're asking why am I talking to you, and I was like, that kind of makes sense because really good habits start early on, and also genetics. You're kind of born with them now. The environment pulls the trigger, the genetics, load the gun, if you will. But at the end of the day, you still have the same genes. So if you want to prepare to prevent an outcome that, let's say, your parents or your grandparents experience, there is no too early time to do. But I would say, people in their 30s and 40s, if you're really proactive, would be a good age range to start. Obviously 42. And so I've already started looking at certain, behavioral changes, supplementations, testings to look for. But I think if anybody's got symptoms, absolutely. If there's memory concerns and focus, execution concerns, balance, or any kind of issues or concerns. But if they have no symptoms, but there's family history, I would say, definitely 30s and 40s if you want to be
Mhm.
really proactive. And I would start with getting a really good assessment of all the parameters and biomarkers that would feed into one's overall health.
Mhm.
And obviously, cognition and brain health is part of that. So some would say do a cognoscopy, as they call it, and do further assessments, how you do like a colonoscopy at age 45 or whatnot. Do something like that as a testing to kind of get a sense of your level of performance for your brain.
Yeah, and I think,
What's your take?
well, yeah, I think, I'd say definitely 30, like 35 is reasonable to start like planning, and being more aware of your own, how you fall in like those 5 pillars. And then I'd say by early 40s, like actually, like definitely like taking action in those areas, because that's when we know um, Alzheimer's changes start building up in the brain is 20 plus years before symptoms. So that's for many people in their late 40s, maybe. So to me, that seems like definitely need to start at that point. But I would say, like, in terms of a cognoscopy in the 30s and 40s, I would say we know if we're not keeping tabs on things. And usually that's due to not paying attention because we're for different reasons. Um, we have too much going on. We're under too much stress. We're not sleeping. And that's, usually when they age, when you maybe have young kids and then maybe you're caring for parents too and other things. So there are reasons for that. So I guess my part of what I'm getting at is not to fear too much that you have like Alzheimer's disease kicking in at 45 because you're not keeping track of things. But it is a good time to reevaluate and get on a better path.
And I would add definitely that there are definitely subtypes of stressors or risk factors too. And I personally was exposed to mold years ago and I started having wart finding issues. And I was like, this is really strange. I'm in my 80s, what's happening? And so it took about a year because it was such a slow leak. Was identified and actually was mold and I had mold toxin exposed, causing me to have the neurotoxins were causing me to have, actual wart finding symptoms. And so environmental exposure is huge. And, whether it's, mold exposure at almost every other house in the country potentially has some mold or, food exposures, certain things that you do not do well with, or heavy metals or other toxins that are environmental, whether industrial or work related. I think that's a big component that I always encourage our patients to look at because there's different subtypes of, exposures, as far as optimizing the blood flow to the brain, reducing inflammation, great, optimizing the metabolic health and sugar, making sure that the cholesterol levels are optimized. But then what else is passing the blood-brain barrier? What else is it getting us exposed? Is it emotional? And so
Yeah.
honoring that, just simple stress from whatever the source is, among other things can contribute to our ability to remember, to have a good functioning brain health.
Yeah. Yeah. And I'm very much in that world of how the, psychologic and emotional challenges can manifest as physical and
Yes.
specifically neurologic symptoms, and how our healthcare system and clinicians still tend to not address those well at all. And the people can leave feeling demoralized because they have those symptoms and they're told they're not real, but they're very real. And I think Sanjay Gupta just published a book about that topic, which is interesting. And as a neurosurgeon, usually You don't expect surgeons to come out with that kind of philosophy, but that's great. I hope that more people take that up. Maybe we can end on the topic of, well, this podcast is called Resilient Aging Unfiltered. So if you could define for us, what to you is resilient aging?
Hmm. That's a tough one. So I think that's very subjective.
Yeah.
But I would say it's to potentially have living a quality long life, a health span, not a lifespan where you actually are very mindful on steps taken for you to get there. And you just did not happen to just bump into that path. You actually
Mm,
worked hard to get there. Whether it's optimizing your musculoskeletal health by resistant and weight resistant exercises or practice, a particular one or performing in a musical instrument to keep the brain sharp. I would say something that is achieved with hard work and a purpose.
great. I love that. Thank you. All right, everybody. Well, thanks for joining us today. I learned a lot that I'm actually going to go implement, and that I don't always say that. So thank you for that. And we'll catch you next time.